homelessness is an issue making waves across Kansas.
People are being transported.
Now, some of the state's largest cities are strapped for resources.
When they get here, find out the resources they were promised don't exist.
It's forcing the issue to the very top. State lawmakers coming together to find a solution.
No one's above the law.
The question is, how does the state plan to get one of its most vulnerable populations off the streets? Kansas's top leaders are trying to figure out what can be done to solve homelessness issues in the state, but it could be a difficult task. You're watching a special edition of Inside Kansas Politics. Welcome in. I'm Rebecca Chung. It's something that's racked the minds of local governments that are struggling to find ways to help. We're diving into this issue, speaking with people on the front lines of tackling homelessness. And joining me right now are Christina Ashe-Guidry, Director of Policy and Planning for United Community Services, or UCS, of Johnson County, and Bill Persinger, CEO of Vallejo Behavioral Health Care.
Well done.
Now, Christina, Bill, let's start off with a look at where things stand in Kansas. Now, in a meeting with state leaders, several stats came up. Let's take a look. Now, Christina, you brought these numbers on behalf of your organization and the Kansas Statewide Homeless Coalition. This is according to HUD, the U.S. Department of Housing and Urban Development. It shows that 2,397 people in Kansas were experiencing homelessness on one night in 2022. 50% were sheltered. Still, a large portion were unsheltered, and that number sitting at 26%. Now, those in transition were at 24%. Christina, how do these numbers stack up against previous years? And also, how big of a leap have we seen in the state's unsheltered population?
Well, Rebecca, Kansas hasn't seen a huge increase in homelessness in the past several years. We have seen, however, a significant increase in unsheltered homelessness. So what we're seeing essentially is shelter beds have reduced and our homeless population has grown to some extent, but really are unsheltered homeless, which is folks who are living in places not intended for human habitation, folks you might see in encampments or living out on the street or in their cars. That's a big population that we see, is folks living in their vehicles.
Right, a lot of people that are on the streets right now, right?
Yes.
And it's something that's affecting a lot of communities.
Absolutely. It's something that really is concerning, and it's unsafe and it's traumatic for the people who are living in unsheltered homelessness, but also for the businesses and the people who are living alongside and working alongside this population. The good news is that when you look at the numbers in Kansas compared to the entire United States, we're still just looking at 0.41% of total homelessness in the United States. So this is a very solvable problem. The number of individuals experiencing homelessness is much smaller than the surrounding states, but we really have to act now to get this trend going in the right direction to solve and end homelessness instead of allowing it to continue to spiral out of control.
Gotcha. And then also, Bill, I wanted to get your take. How does this align with what you're seeing in behavioral health?
You know, we have seen an increase in the number of unsheltered individuals in Shawnee County. Our point in time count last January was 412. I believe that was up from 2022 by 50 or 60 individuals. So there has been a bit of an upward trend here, and a pretty tremendous response on the part of the community. Although that response is evolving, you know, the good stuff we've been doing, we're working on how can we take that to the next level now, and try to extend a helping hand to our unsheltered neighbors, and recognizing that's a very heterogeneous population. People with all kinds of stories. Everyone has a story, and many of them are sad and tragic, and individuals down on their luck, and people struggling with addiction and mental illness, and a loss of family contacts, and just looking for a hand up and not a hand out. So our response is evolving.
And I believe the number of people, or the percentage of people that are experiencing homelessness and have issues with mental health, around 30%, right?
Yeah, it's a significant number. I don't recall what it is right now, but we do know that a lot of our homeless and unsheltered and other people who may be living in unsafe facilities, houses without any kind of utilities, a number are struggling with addiction and mental illness, and some with both.
Absolutely, and I can dig into those figures if you want, Rebecca. So in Johnson County, in our point-in-time count, we do really detailed interviews with everyone that we encounter. And what we see is that about 30% of the population that we encounter are actually fleeing an active domestic violence situation. So they are in danger for their lives, and they are leaving an unsafe home, and they're going somewhere else that they feel like they would be safer. And unfortunately, sometimes that's unsheltered. We are also seeing a significant number of folks who have a recent eviction on their record, and when you have an eviction on your record, it's really challenging to get new housing. So that's about 23% of the population. And you're exactly right, about 30% of the population has either a chronic mental health or physical health disability or chronic health condition. And then in Johnson County, when we think about folks who have an additional factor of substance use challenges, that's about 19% of the population. I think what's really interesting to realize, though, is that about 55% of the people that we encountered have income. So these are people who are working or who have some kind of disability, and they still cannot afford housing. 44% are experiencing homelessness for the first time in their lives. So I think that we hear and see kind of this narrative that the homelessness in Kansas is very visible, that it's very outdoors. And in fact, what we see in Johnson County is that that's only about 11% of our population. And so really 80 to 85% of the folks that we deal with are temporarily experiencing homelessness for a short term. They need support for a month or two, or they need to be in transitional housing for 3 or 4 or 5 months to kind of get their finances in order, to get their health in order, and then they're able to stabilize permanently. We have remarkable programs in this state. Salvation Army Family Lodge in Olathe, for example, deals with families, and they have a 98% success rate for long-term stability. That's that their folks who graduate from their program, 98% of them graduate and never return to homelessness again. So we know that there are some amazing programs that work really effectively in our state.
And you mentioned, Johnson County, it may not be as visible as maybe other counties with lower amount of resources, right?
Yeah, and so when you think about the state as a whole, we think about 16% of the folks are experiencing chronic homelessness, which is generally going to be unsheltered. That's folks who have been living outside for at least a year in the past 3 years and have a diagnosed disability. But again, that's a very small segment of the population experiencing homelessness compared to the number of folks who are, for example, fleeing domestic violence or have children and are students who are interacting with the school system and have lost housing. A huge trend I know that we're seeing, Bill, and I'm sure you're seeing too, is seniors, folks over the age of 55 who have worked their whole lives, but we've seen rental increases of 13% on average across the state, but in urban areas 20-30%, and their income is just not keeping pace, and so they're living in their cars for the first time in their lives, having spent their whole lives working here as Kansans.
Wow. And then also talking about contributing factors, so domestic violence being one of them, but Bill, also mental health. Mental
health and addiction, and with advancing age of individuals who are unsheltered, and the Topeka Rescue Mission here has collected quite a bit of data and found out that quite a number are from Topeka and Shawnee County, consider themselves, local individuals, and so these are truly our neighbors and people who need our help. But along with advancing age comes increasing concerns about health problems and how do you manage your health if you live in a tent? I mean, how do you keep your vitamins from spoiling? How do you get a proper amount of water? How do you get proper sleep? How do you get proper dental care, and all of those things that can really lead to poor health, and a bad diet leading eventually to diabetes and other concerns and heart disease and mobility problems. It's become quite an issue, and some very unique programs going on in Topeka and Shawnee County. I know our neighbors to the east are working hard on that as well. But here we have the mobile access partnership MAP a couple days a week. We have a shower trailer and a food trailer and primary health care provided by a partnership of nonprofit, faith-based, and government partners. It's been going since May of 21 and served well north of about 1,300 or 1,400 distinct individuals in that amount of time, trying to give people, a hand up, try to, I guess in a way, get in their way, and let them know that someone cares, so that when they're ready for help, they can reach out and try to overcome that addiction problem, methamphetamine problem, alcoholism, the other forms of substance abuse. And with someone who's experienced a serious mental illness, you want to create a connection with that individual that gives them trust and some hope as well. And so our homeless efforts here, our efforts to help people who are unsheltered, really built around trust and just being in their environment as often as we possibly can, every day as a matter of fact. And especially when the weather turns extremely cold, with a task force we formed to bring people out of the cold so they can survive the really harsh weather. But a lot of great things are going on, but we are concerned about that population aging, and we don't want to think about our unsheltered neighbors as people from somewhere else. They're our folks, they're our Kansans, they're our fellow neighbors, and if they're not, find that Kansas is a welcoming place, that we try to help people here. It's part of our Midwest values.
I think something that's really interesting, Rebecca, is the law enforcement response has been phenomenal. In many, many cities and counties across the state. When our law enforcement are going to these great lengths to help our neighbors, they have to have someplace to take them. So we have to have these mental health and substance use treatment facilities for folks to be in recovery.
All right, Christina, Bill, a lot to talk about. But thank you so much. We're going to come back after the break. We'll continue our conversation. And when we come back, up next, how Kansas compares to other states and what issues are at the top of the list. We'll be right back. You're watching Inside Kansas Politics.
It's the most wonderful time of year to sign your name. Volkswagen Sign Then Drive sales event is back at Crown VW in Lawrence. Choose from select models, including the 2024 Tiguan, designed to fit your life. 0 down payment, 0 security deposit, 0 first month's payment, 0 do-it signing.
It was amazing.
It's just like coming to see friends.
I've enjoyed my Crown experience when I started 30 years ago.
Finally, vacation. A moment to relax, unplug, and enjoy some peace and quiet. Except you're not on vacation this year because your old wood windows need expensive maintenance and repairs. Maybe you'll see the beach next year. At Renewal by Andersen, our exclusive long-lasting Fibrex windows give you the durability of wood and the low maintenance of vinyl. So relax and let your windows work hard instead of you. Visit our website to claim this month's offer and schedule your free consultation.
At Renewal by Andersen, we have an extensive collection of beautiful and functional window options, perfectly designed and custom built for your home. But that's not our only collection. We're also the most awarded among manufacturer brands in the J.D. Power Windows and Patio Doors Satisfaction Study, including the most awarded for customer satisfaction. Schedule your free consultation to discover why. Renewal by Andersen, the better way to a better window.
At Affordable Dentures and Implants, we believe in the healing power of a new smile, the way it makes you look and feel, the way a smile lights up a room, so people can see the best version of you, which is why we make new smiles affordable for everyone, so you don't need to wait another day to get your smile back. Scan the QR code to learn more, or visit affordabledentures.com.
Go ahead and smile.
Welcome back to this special edition of Inside Kansas Politics. We've talked about current trends we're seeing in Kansas. Now we're looking at how the Sunflower State compares to the rest of the U.S. Now, Christina, Bill, I pulled some of these numbers from HUD's 2022 report. Let's pull those up real quick. In a single night in 2022, more than 582,000 people across the U.S. were experiencing homelessness. Correct. Now, more than half of all those people experiencing homelessness in the country were in 4 states. But these states had homelessness numbers in the double digits. So Kansas has a much smaller population. So it doesn't hold a large portion of the United States homeless population, of course. But still, it seems like it feels like a larger issue for some businesses and some community members. They're calling on lawmakers to help now, and that's been the biggest thing. We were at that meeting and we were able to confirm that it's becoming such a big issue that some people are being sent to other parts of the state where they could potentially have more resources, only to find out that those resources are also limited or, like one officer said, don't exist. So, Christina, what are some of those areas that you think are coming up short?
Yeah, so we have some data on this. We know that Kansas actually landed dead last in access to mental health care across the state. That's a huge issue. We have to have access to mental health care. We have to have mental health care facilities and substance use treatment facilities. We are also ranked really poorly on access to health care. We have the highest number of rural hospitals that are in danger of closing in the United States. And so when you don't have a place to take someone who needs to stabilize and be in recovery, who's in unsafe, unsheltered homelessness and may have a mental health or substance use disorder, they have to have a place to go to be treated effectively.
And then Bill, what's your take on that?
Sure, I think various communities respond in different ways. I know here in Topeka, for quite a few years we've been concerned about people, camping, living along the river, overpasses, people in high traffic areas and various and sundry public safety measures that we have taken. I do know it does take a combined effort of city, county, and state. The co-responder program that was mentioned, the MAP program, the CIT training, most if not all the Topeka City Police Department has been trained in crisis intervention training, many of the sheriff's deputies. So we try to respond in groups and teams, and we know our homeless neighbors, many of them by name. We know what their needs are. We try to anticipate those needs so that we can kind of get out in front of some of the crises that may occur. But every community is very different in the way they experience homelessness, and that community response is going to be different. I know we're a large concentration of effort on working upstream, so to speak, to get ahead of issues that might arise, with health and personal safety and mental health and addictions, and just that takes a real team effort. So there's a pretty assertive community effort going on right now that we're a part of, a work group that hope to create some very concrete solutions. Low barrier housing's been discussed, more access to detox beds, some things like that.
Okay, and that's one of the areas, more access to detox beds that are maybe limiting the mental health field too.
It does, it does,
okay.
You bet.
Gotcha. Well, Bill, Christina, thank you. When we come back, what can be done to fix homelessness issues in Kansas? We're tackling that question next. We'll be right back. You're watching Inside Kansas Politics.
Hi folks, Rodney Robertson with Window Design and Remodeling. We recently constructed this addition on this home and added this beautiful deck. We removed the back wall and added 300 square feet of kitchen and dining area. Just look at the difference from before to after. Call Window Design and Remodeling today or visit our website. We are your home remodeling specialist.
Hi, I'm Eric Wilson with Capital City Flooring. We have the flooring for your style and budget. With our in-house installers, rest assured you will have our people in your home providing the best workmanship and quality. Capital City Flooring, where fine quality and service matter most.
When I was in foster care, I never knew when I would have to move. So I always had my suitcase ready to go. Then one day I was adopted. My new parents opened their hearts and home to me. My parents cook my favorite breakfast for me every morning. My parents take me on trips I never thought I would go on. They gave me a home and an even better reason to use that suitcase. My parents aren't perfect, but they're perfect for me.
Every morning, it's a brand new day. Your wake-up call to a fresh start. And 27 News is working for you to bring you breaking news from overnight, a forecast to help you plan your day, and information that can help make your day easier. We keep you updated on weather conditions for when you're heading out the door and when you're heading home. Whatever your morning routine, we're working to bring you all the local news you need. 27 News, working for you. Get your local news first on Fox 43 News at 9. Local news, weather, and sports. Every night at 9. It's your local news an hour earlier. Fox 43 News at 9. First on Fox.
Welcome back to this special edition of Inside Kansas Politics. We're continuing our conversation on homelessness. We've heard about limited resources, and now we're focusing on solutions. Christina, could you start us off?
Absolutely. So Rebecca, I think the first thing that we do is we have to go upstream. So we have to look at the Kansas housing shortage. We don't have nearly enough housing. This is something that has affected literally every family in Kansas. Stop and think about your retirees who can't downsize because there's nowhere for them to go. Your young families who would like to be in a home for the first time in their lives and there's nowhere for them to go. Your workforce, we have our cities and counties who cannot staff up. We're short on our law enforcement, our nurses, our school teachers, because there's nowhere for them to live. That has created housing cost burdened Kansans. That means Kansans who are paying more than 30% of their gross income on housing each month. When we have over 40% of our renters in Kansas paying that much for their rent, they can't afford to save their money. They can't get ahead. They can't pay for emergency expenses. And so then they're vulnerable to losing housing. And what we see is each year over 14,500 evictions are filed in our court system. 75% of those go to a judgment for eviction, and so that's 11,000 landlords that don't get paid, and that's 11,000 households that lose their housing. So the court system is worried about this. It has pilot programs going in multiple court districts now, but the state could step in here and create a revolving loan fund for rent assistance and provide low or zero interest or forgivable loans to keep those folks housed, to pay our landlords, to keep our economy strong, and to prevent us from having more folks going into unsheltered homelessness. So that's one way.
Okay, and then Bill, what about you?
So locally here in Topeka and Shawnee County, we formed a group, a coalition of agencies and governmental, nonprofit, and faith-based a couple of years ago called the Intersection Coalition. And one of the things that we've been working on pretty hard lately is the idea of a one-stop shop, a place, kind of a re-entry center. For example, we do know, at least in Shawnee County, quite a few people who will leave the county jail and enter homelessness, or maybe a living situation that's not ideal, you know, where they don't have a permanent, safe and home. So we're thinking about upon re-entry into the community, or even for people who are in the community already, can we create a one-stop, a physical place where people can go and actually get enrolled in services, receive care, develop that trust relationship we talked about earlier. So one of the upstream things we're looking at here is early intervention and prevention. You know, just try to get those services going with people just the minute they set foot on the ground. If they're leaving a correctional facility, if they're coming back from a state psychiatric hospital, maybe they recently become unhoused, they just don't know what to do. A real place with real people who can get them plugged into services and get them outfitted with the things they need right away. So it's a community project we have going on right now. We talking about that recently. So
thank you both. We'll be right back after a short break.
Go ahead, dream big. Save on new flooring now with 3-room deals for your entire home. Only at Carpet One. Carpet, any 3 rooms from $39 a month for 36 months. Luxury vinyl, any 3 rooms as low as $69 a month. Hardwood, get 3 rooms full from $99 a month. All with 36 months to pay, interest-free, and no money down. Dream big, save big. Get 3-room deals now only at Carpet One. The easy choice for all floors.
The 27 News Storm Tracker is sponsored by D.L. Smith Electric, bringing your vision to life.
The Black Friday event is going on now at the Mattress Hub. Save up to 50% off store-wide, plus get doorbuster deals like this Sealy mattress at $299, free adjustable bases, and Amazon gift cards up to $300. Black Friday savings and more, only at the Mattress Hub.
It's not a good day, it's a great day at Continental Siding. We're having a siding inventory blowout sale. If your favorite color is in this building, it's on sale. Now that we've grown to 5 locations across 3 states, we're preparing for a massive overhaul of our distribution center. We've got to change in order to keep up with demand. Our growing pains are your home improvement gains. The good news is we've got a lot of colors now, but the catch is they won't last long. Click.
Car accident? You might think it's best to wait and see before calling a lawyer.
But don't do it. Wait and see can turn into wait and lose.
Once the insurance company thinks you're desperate for money, they may offer you less than you really deserve. A lot less.
At Devon James, we don't believe in wait and see.
We believe in fight and win. Call us now, and we'll fight for every dollar you deserve. Devon James wins. Call 888-8888.
Join our conversation on Facebook.
Welcome back to this special edition of Inside Kansas Politics. We're wrapping up our conversation on homelessness with community advocates and mental health leaders. Now, our final question is, what can be done at the state and local level? What is something that local governments can do that's not being done right now? And how can lawmakers, state lawmakers, step in? Christina.
So I have two recommendations. So first, the state can incentivize the development of more affordable housing that meets the needs of Kansans. They have a lot of levers that they can use to do this. They can use the low-income housing tax credit. They can use a local ad valorem tax reduction fund. They can use the housing trust fund. But if they would support our counties by providing them a little bit of funding, then counties and cities would have the ability to expedite the development process, and then community members would be able to say yes to their retirees downsizing, to their families getting new housing, to their workforce living in their community, and to having their unsheltered homeless in housing. So that's one. The second is the state should provide matching funding for the continuums of care on homelessness. So the continuums of care are able to access federal funding, but they have to come up with the 25% match for that funding themselves. That's a huge burden. The state could make that 25% match. That would have only cost them about $2.2 million this past year for the entire state. And with that investment, they could also tie to that coordinated data collection and outcomes. So then we can be all working off the same data, all working on the same page, and finding the best solutions, the best evidence practices to solve this problem.
And then Bill, speaking of healthcare, right, how do people access healthcare when they're homeless? Is that something that the state can address next year?
I think so. Of course, Medicaid expansion would always help, but I think local, state, and county leaders, just always keeping public safety, homelessness, healthcare, social services on the agenda, both the informal and the formal agenda. And coming to local partners and say, let's create that partnership. So I think that's just putting it first of mind, on our agendas would be very helpful. The state could use some more state psychiatric hospital beds, short-term crisis care, so that we can get ahead of that problem, get people back home. Funding for substance abuse, mental health services, other social services, like access to food is becoming a real issue with some of our folks who are unsheltered. Just not enough food security, and the foods that may have access to is not the healthiest that they could get because it's affordable. So, but affordable, good food. So I think keeping it on the agenda, expanding Medicaid, creating some more short-term psychiatric hospital beds, more detox beds, but really engaging their constituents in a conversation that's real, that's local, and action-oriented, I would say. Something that really let's get something done, because something can be done, but we all have to team up to get that done.
And I think that community members have a real role to play here. You can find out who your continuum of care is. You can volunteer with partners. You can donate food. You could donate clothing. You can have this conversation with your neighbors and say, hey, what is our housing shortage here?
Right.
Who do we need to say yes to? What types of housing do we need to talk to our local government about adding here? And so we, each of us gets to be part of this solution.
Okay, Christina, Bill, thank you. And that's all we have for now. We're working for you, continuing to track this issue and get answers. Thank you for tuning in.